assisted therapy?
So when we first started, like, figuring out what we wanted to do, we wanted to do mental health because all three of us have, like, interest in mental health. So we started with schizophrenia and a bunch of things that did not work out. We got super stressed about it and it was very obnoxious. So we turned to animal assisted therapy in patients with like anxiety, and some also have like a mental illness along with the anxiety.
So our people question that we came up with was, does animal assisted therapy improve stress levels for people with anxiety compared to music therapy?
So why did we pick this topic? So going along what Nikki presented to you guys, that we all have an interest in mental health. Anxiety is going to be obviously a common diagnosis that we see in that setting, along with the people that we are going to work with. As everybody say, we all experience anxiety somehow, some way. We are all able to find peace when it comes to working with animals. It could be dogs. If you guys aren't a fan of dogs, it could be cats, it could be any kind of animals. But we also wanted to compare animal assisted therapy to music therapy in order to see the positive correlation that animal assisted therapy actually has on individuals with anxiety.
So this is my article, and it talked about how animal assisted therapy works with patients with psychotic disorders or struggling with anxiety. So the definition of animal assisted therapy is the interaction between a patient and a trained professional along with the dog's owner. So my study used 230 patients who suffer from anxiety. They used a pre and post-treatment crossover study designed to compare the effects of a single animal-assisted therapy session with those of a regular therapy session that you would just normally do. Their objective again was to determine if animal-assisted therapy was effective in reducing anxiety levels in patients with psychotic disorders. So before and after participating in the two types of sessions, subjects completed the state trait anxiety inventory and which is a self-report measure of anxiety that they are currently feeling, just to form a baseline. So that way when they did do the test at the end of when they received the animal assisted therapy, we could see where they moved from where they began to where they ended on their anxiety level. They used a mixed models repeated measure analysis to test the difference in scores from before and after the two types of sessions. The results provided statistically significant reductions in anxiety scores of all psychiatric conditions after participating in animal-assisted therapy, and it also confirmed that there is an immediate effect on the state of anxiety felt by these patients after receiving animal-assisted therapy. However, there's going to need to be further research on our end to determine if there will be long-lasting effects, because this was only a one-time treatment. They didn't do it over the course of weeks or months or whatever. But all in all, it was clear that the use of animals in therapy drastically decreases the anxiety levels in patients who are suffering from anxiety and may also have a psychotic disorder.
Okay, so my article was titled Resident and Therapist Views of Animal Assisted Therapy, Implications for OT. So my article was pretty straightforward because it was a qualitative study. It basically separated the resident statements and then the OT statements, and as to why they think animal assisted therapy is beneficial and in terms of improving their anxiety. So animal assisted therapy can be used for specific multiple interventions through multiple professionals, obviously with OTs, but you can use it with PTs as well, along with certified animal assisted therapists. I know for Nikki's OT honors, they actually have somebody come in and bring in the animals, so that actually has people come in more to the honors, which can obviously show a different positive correlation with that. And also therapeutic recreational specialists can also bring them in as well. So in terms of the resident statements, throughout the article, some statements that were presented were that the animals brightened their day. It brought up positive memories throughout their life, whether it was older individuals having a pet when they were younger, or maybe playing with their grandchildren with the pet. It also made the family feel better as a whole, and it helped them get their mind off things, which obviously we can all relate to. In terms of the OT statements, this is more what we're looking for in terms of how can we bring a positive environment to our clients. So one of them is motivation. So the statement that was provided for this is that motivation is increased with animal interaction. So what residents know that animals are in therapy, they're more likely to go. Residents benefit physically from intervention with animals, so it actually will help increase range of motion, better sensory modulation, as well as higher tolerance for physical activity even when pain is presented. Another one is animals promote reminiscence and alertness. So if OTs are actually working with those with cognitive disabilities, they may actually show symptoms that they're more cognitively aware. And lastly, animal-assisted therapy enhances emotional well-being. So if you come in and patients are agitated, they're more likely to participate in the interventions because the animals are there.
Okay, so for my article, it was focused on the music therapy aspect. It was done on a relatively small sample, but it included men and female, so you could see the differences between whether you have higher effects in the female or the males. The research design was a quasi-experimental with a pre and post test, so they measured it before and after. And there was a control group and an experimental group, and obviously with the control group, there was no music played during, in this case, during dialysis. And then the experimental had music playing, and the music was calming music. And a plus side to music therapy is that it's non-invasive, and the benefits showed that it decreased the blood pressure in the patients, and it also benefited the patients emotionally and physically. The results from this study focused on or showed that music therapy is effective in reducing the levels of depression, anxiety, and stress that one may feel. And between the two groups, it was statistically significant that there was a difference between the control group and the experimental group with the levels of depression, anxiety, of stress the individuals had. So, in the conclusion to our PICO question, we found or came to the conclusion that overall, all of three of our articles showed that both animal-assisted therapy and music therapy were effective in reducing the stress levels and anxiety